this obviously saved time, and opposed to other vaccines in which until the 3 phases are completed, the reports are not sent to the expert team for analysis. In this case, as soon as 1 phase was completed, the documents were sent for analysis. And of course, this also saves time because you don't need them to review the whole thing at the end, but rather it's being reviewed as it's happening. And I think the other important thing that helped to scale up COVID-19 vaccine, and I must say, and I agree with Dr. JERROL, the development of COVID-19 vaccine and the technology used is going to go to history, and it's changed. I think this is a moment in change now for future vaccines because this has been incredible. Is the technology. The sequence for this specific COVID-19 was known in less than a month. By January, they already knew the sequence for it. And this is because having all these technology available. So coming back to your other question in terms of why so many vaccines. So what the COVAX facility did was, once they saw that a manufacturer vaccine had a lot of potential, funds were provided to them so they can scale up. And then they provided to another one. So they had a vast portfolio. Why that helps? Because the possibilities of finding one increases if we have more manufacturers or more researchers. So what happened is that at the end, most of them proved to be successful, which was expected because the coronavirus is not new to researchers. I mean, we've dealt with coronavirus before, so we were not starting from zero. So I think the fact that the facility was able to finance several manufacturers to scale up their research was a strategy, as opposed to putting all our funds in one manufacturer and then it turned out that this product would not be successful, was too risky. So they had a broader portfolio, and this of course proved to be successful. I'm not sure if Dr. JERROL wants to add to that as well.
Yes, Teresa. What I want to say is that there have been over 176 initiatives. And even though we are so appreciative of the COVAX facility, funding has come from other sources, like Warp Speed. They've put $18 billion into vaccine development. And other countries have been developing their own. The Chinese, the Australians, and the Germans, Russians. So there've been a lot of initiatives. And already, I want to tell you that a lot of vaccines have dropped off the table. They failed. They have not been seen to be effective in terms of methods they use. But those that have come forward, they have been quite, some of them, especially those at the top, have been quite unique because they've been using methods that started since the first SARS outbreak in 2003. And so what we call, I'm going to say this name, the messenger RNA type development started in 2005. And in terms of the others, like the Oxford University, AstraZeneca, the Sputnik, they took initiatives coming out of the Ebola outbreak in 2013, 2014. And so they use those methods using an adenovirus, and they've been able to, and I think the important point that Darlene said was that the Chinese, apart from what you might say about the Chinese, they provided the world in January with the code for the outside coating and the genetic code on the outside of the virus. And those companies have been able, that's been a gold mine. They've been able to use that, something that they would have taken a long time to develop themselves. So being handed that, they were able to run with it, and with the money, really go and develop these vaccines. And so we now have a group of frontline vaccines that are working, but I want everybody to know there's still vaccine development still in preclinical stages. There's some that are just in phase 1 and phase 2. These are the ones that have really gotten the boost with the money, and I'm grateful for that. I'm glad we don't have to wait for 2 years and 3 years for a vaccine. You know what I mean? Then we would have been in real trouble, I think, you know?
So basically, we are saying two things here, from my understanding. One, the coronavirus is not new to us. And secondly, financing has been a critical component of this entire process.
Let me just correct that a bit. Now, when I say not new, coronavirus as a family, we've always had coronaviruses, the alpha coronavirus that give the common cold. And then SARS-1 that we had in 20, was a beta coronavirus, the first beta. Then we had another one called MERS in the Middle East. They were new at the time. The one we have now is, and that's what we call it, a novel coronavirus. It's a new coronavirus, but when we look at the genetic makeup, it's about 60 to 70% similar to the one that we had in 2003, but it's a definite distinct virus. So I don't want to say that it was there long ago or before, but we've known coronaviruses for a long time, and we have been looking to develop things for SARS and for another coronavirus called MERS, Middle Eastern Respiratory Syndrome, and this new one that's been around now for a year. If you still want to call it new, I mean, to me, it's been around a long time. It's been around too long. And I would say that in that case, we still have to consider it as a novel coronavirus because it's new in its own right.
Okay, thank you for making that distinction. So someone wants to know, does the COVID vaccine prevent contracting and or spreading the virus? From what I understand, it only minimizes the effects to some degree if you contract the virus.
Well, I would say it's much more than that. And let's put it this way. Right now, and I'm going to keep on saying this for the whole program, we've been using hands, space, and face mask. And we've been looking through COVAX for all sorts of medication. Remember, Donald Trump was trying to use some malaria medication, with other things. We've tried all kind of things. Teresa, unfortunately, not a lot has worked. There's something they call monoclonal antibodies. You can get it in a drip. That's what Donald Trump got when he went into the hospital, along with some steroids, and he seemed to have done well. But you know, those monoclonal antibodies, I don't want to tell you the price for a bag of those. You understand? You don't want to know the price for a bag of monoclonal antibodies. But instead of getting monoclonal antibodies, instead you can get another antibodies in a different way through vaccines. You understand? So you could try and get Donald Trump's monoclonal antibodies, or you can develop the antibodies to kill the virus through vaccines. Now, what it does is that mask would stop the virus from getting into your system, a kind of an external barrier. But once the virus gets in, if you've been vaccinated and your antibodies are already primed and ready, as soon as the virus tries to get in, yes, it may do a small kind of infection, but unless it's a bad mutant, your vaccine antibodies are going to jump on it, deal with it, and literally neutralize them and destroy them. So it will prevent any kind of severe infection and may limit this to a very mild infection. And yes, if you don't get a severe infection and you're not spitting out all the virus, then your ability to transmit the disease will be reduced. It won't be totally eliminated, but it will be significantly reduced.
Okay, and someone else is asking, how effective will the vaccine be, factoring in that the virus is still mutating?
So I wanted to top up a bit on what JERROL was saying, because he was saying unless the variant, and I think that's an important other benefit from the vaccine, we need to stop the transmission, because the more the virus is transmitting, the more possibility it has of varying. And that's why we're facing now these challenges with the various variants. So what we need to do is stop transmission, as this is a natural mechanism of the virus to deal with where he is. So he keeps mutating. So if we could stop this transmission, of course, the possibility of the virus mutating is less. Now, the challenge we have now, and luckily, as far as I know, that's not the main circulating virus in the Caribbean, although some countries have reported having some of these variants, is as the question is saying, is it as effective to the variants? And the most likely is probably not. Why? Because when the vaccine was developed, these variants didn't exist. Now, the fact of that this is still part of the same coronavirus might require some adjustment it may be. But the thing is that we do know it provides some protection. And since this is what we have at the moment, the ideal thing then is to get vaccinated, because again, we need to stop transmission, or not, we're going to have more variants, and then we're going to have another phase of the pandemic that I don't want to think of. So yes, we still recommend that persons be vaccinated.
Okay, Doc, I'm being told to tell you.
I saw it. Sorry, I apologize. I'm hugging the camera too much, right? Okay, sorry. Yes.
Okay, and we have a question. Do you have any projections as to when our entire population will be vaccinated?
Well, I think I should take that on. Now, Teresa, in terms of our goals, we need to vaccinate as the first goal 70% of our population. Now, you may find that strange, but each virus has a special number. We call it the R0, the R number. Measles is so contagious, you need to have at least 95, 96% of your population vaccinated. And we hit that target every year, 95.5%. For the coronavirus, the calculations are we need between 60 to 70, let's say 70%, and anything above that is more or less like barter. I'm saying this very carefully because we want to aim for a much higher number. But once you reach 70%, the virus is not able to penetrate and reach the person because it's getting blocked by people who are already vaccinated, by people who will not be able to pass it on as much. You know what I mean? And so the virus epidemic here and this pandemic fizzles out. And so I want to say 70%, but we are going to strive against the odds because we know there are a lot of people out there who have picked up on a lot of craziness, a lot of things that they think what they've read is correct. And we've got to work to reduce those thoughts or correct those thoughts. And I think we can reach 70%. We're going to have a harder time going to 80%, going to 90%, but we're going to try and put every single effort in to try and educate the people in that regard.
Okay, thank you, Doc. When we come back after this, our second break, we want to talk a little bit about vaccine efficacy as opposed to vaccine effectiveness. We'll be back in just a moment.
Spread of viral infections, including the flu and COVID-19, by practicing proper hand washing. Follow these simple steps. Remove all jewelry before washing hands. Wet hands using running water. Place liquid soap in hand. Circulate using rotational movements, interlace fingers, and repeat switching hands. Wash back of fingers, rotating them in the palms. Wash fingertips, rotating them in palms. Wash thumbs using rotational movements. Thoroughly wash hands down to the wrists. Rinse hands. Dry with clean tissue. Turn off tap using tissue. Use tissue to open door and discard in bin. A simple act can make a huge difference. Stop the spread of viral infections, including the flu and COVID-19, by practicing proper hand washing. This is a message from the Ministry of Health, Wellness and the Environment.
Welcome back. And Doc, we wanted to explore the difference between the efficacy of the vaccine as against its effectiveness, if you will.
Yes. Now, let me say that vaccines can be effective in terms of the way they neutralize, they create antibodies, and they actually kill a virus. But the rate at which it does it, the way in which it does it, may often be very different. And some people don't want to make a distinction between effectiveness and efficacy. I'm not sure there's a need to really go into that sort of detail. What we are more interested in is the overall efficacy. And we're seeing that Pfizer has an efficacy of 95%, Moderna 94%, the Sputnik 92%, the Oxford University AstraZeneca, you could say 90%. And you also have Johnson & Johnson, Moderna, and some of the other viruses. Now, there's one out of China that's only 50.4% efficacy, but it's still being used in a significant way. You know what I mean? The Johnson & Johnson is a single dose, and it is said whether it's between 66 and 71% efficacy. There, you know, people see the advantage of having a single dose instead of people having to come back for a second dose. But, you know, I was going to go into the technical detail of the difference between effectiveness and efficacy. I think that might confuse person. The whole thing is the overall efficacy. And given those numbers, we use those in some measure of comparison. But luckily, a lot of them are still up in the 90s. And if the pass mark is 50%, and they're all getting an A plus, then that's what I tend to look at, you know, that they're quite effective. But that is still said in the context of a new variant, a mutation, and so forth. If a new mutation comes along, it may be less effective against that mutation. And so we always have this. So, and I think as Darlene was saying, the bulk of the species that is around in the Caribbean, we haven't as yet detected the British UK variant here. We know it's in Barbados, we know it's in Trinidad, we know it's in St. Lucia. I wouldn't be surprised if it's here. I wouldn't be surprised if that's what caused the spike. But it would seem as if the variant may allow the virus to be more contagious, but the vaccine may still be effective in neutralizing the virus itself. And so I don't know if I've given justice to the term efficacy. And I think that's what we should use. Rather than trying to use 2 or 3 different terms, let persons understand efficacy in terms of it's a calculation that we go. And I think that a lot of the vaccines we're going for are in that 90 percentile, which I would say is damn good. You know what I mean? And we have to look and make sure we don't allow these other mutants that will come in that may have a lower, may could drive the efficacy down.
Okay, someone is asking, do all the vaccines being produced worldwide have a version for those with peanut and tree nut allergies? I'm not sure if...
Specific to peanut and tree allergies, what the WHO general recommendation is, and I must say this has been noted more with the Pfizer and the Moderna, in which we heard of persons that had allergic reaction after receiving the vaccine. What WHO recommendation is, if the person has a history of severe allergic reaction after receiving some sort of vaccines, and if they have a history of severe allergic reaction to any component of the vaccine, then this does not necessarily mean the person cannot get the vaccine if they're in the high risk group. So the person will need to measure the risk benefit, but they should also consult with their physician if that should be the case, and be receive the vaccine in an environment in which immediate medical attention can be provided to this person. Now, as far as I know of the components, I've never seen anything similar to peanuts or like that. So I wouldn't think that that would trigger it in someone that has previous allergy to peanuts. But again, as I said, the recommendation is not just any allergies, like, it's severe allergic reaction that you had in previous with a vaccine. And then that's when they're asking to take this additional precaution. But in general, no.
Teresa, if I could come back in here. Now, in the past, some of the vaccines that we developed, we may have used eggs as a method of, growing the virus in order to develop it. And some of the egg protein may have been left over. So therefore, some individuals who might have been allergic to eggs could have had a small allergic reactions if they were allergic to eggs. And in the 176 vaccine developments that are taking place, it may be that somebody's doing something that may be developed in something where there could be the potential for allergies. But I want it to be clear, the ones we are looking at is a group of about 8 or 9 vaccines right now. And really, I would say that it's just the Moderna and the Pfizer that have had a little problem with what they call anaphylaxis. Now, they say that over 70 million vaccines have been given out already for Pfizer and Moderna. And there have been 40 cases as of a week and a half ago of this anaphylaxis. There were 3 people who went into the hospital, nobody died. And it is recommended if anybody does have a severe allergy, the people who walk around with a special pen that has in adrenaline, an injection, and they're worried if they have a bee sting, or they're worried about some kind of allergy. And they would walk around in their bag or their pocket, and if they develop an allergy, they know they would give themselves that adrenaline and that will help them. But we have had about 40 cases out of close to 70 million of the Moderna and the Pfizer. But with the Sputnik, the AstraZeneca, and I'm thinking with the Johnson & Johnson, that has not been a problem. And none of them, I know, have used peanuts as one of the ingredients in any form or fashion to develop any kind of peanut allergy, you know?
Okay, I see 3 quick questions. Is the government getting cutbacks from these vaccine initiatives? I don't know where that is coming from. Probably all the governments of the world. As often the people are sold out to corporate dealers. Then there's another one. Should one undergo blood testing to see if they are a perfect candidate for the vaccine? And someone has asked if you can explain the increase in the fatality rate.
Yes, I mean, I could tell you that I want to make, and I've said it before, Gerald Thompson, have no financial interest in stock market or anything of that nature, in any vaccine or any vaccine product, or any medical product. And the government absolutely does not have any deals with these at all. Now, this is part of the usual conspiracy theory, because we believe that those things are possible. And so we say we don't want to be part of that, so we're not taking the vaccine because it could be possible that the government has a deal or something like that. And I want to show persons that we have to really deal with some of these kind of conspiracy theories. I lost my train of thought with the other question, but
the other question had to do with if someone should have a blood test to determine if they're a perfect candidate for the vaccine.
Well, no, we want everybody to receive it. Those persons who are already positive, it's been suggested that they could wait until 3 months after they were positive to receive the vaccine. We believe they should still receive the vaccine, but they should wait for about 3 months after, and not straight away. There's no need for any kind of immediate blood test. But if somebody is diabetic, if somebody is hypertensive, somebody has some serious, we want you to continue seeing your doctor and keep your blood sugar under control and so forth. And if you are vulnerable, diabetes, hypertensive, arthritic, any of those kind of, you're a cancer patient and you're aged, we think you're in the front line to receive the vaccine, and you should receive the vaccine as soon as we get vaccine for you. And so.
Okay, and somebody was inquiring about the increased spread or increased rate in fatalities.
In the death.
And do you think we will have to offer multiple vaccines to fight the variant?
Can I just weigh in something on the previous and I think because I've heard this question before about the bilaterals. And what happened is most countries that are in the COVAX facility, the COVAX facility agreement establishes an amount of up to 20% of the population. So what happens? Countries have to then consider for the remaining population, and that's what countries then need to get engaged with bilateral deals with manufacturers. Now, the proposal has been that the COVAX can continue beyond the 20%, but as for today, the COVAX agreement is only for 20% of population. This was based on the manufacturer's capacity and the same challenge to ensure that everybody gets some. So then that's why I think that might be a confusion in which countries are thinking that, you're going outside the COVAX. That happens because you need to then get the other remaining 80% of your population vaccinated, and then you need to reach out to other manufacturers or other countries that are willing to do donations, etc. Now, regarding the increased fatality, and I guess Dr. JERROL would address that a bit more in terms of specificity to St. Vincent. But as long as you have more cases, your fatality rate will increase. As incidents go up, fatality rate goes up. So if you have more people being infected, it's very likely then that more people will die. And I guess, again, that's why we come back to the need of having the vaccine and persons being vaccinated to reduce the incidence, the efficacy of the vaccine, and then to reduce the fatality. Over.
Yeah, Teresa, if I could add to that on the fatality, the persons who are doing worse, who are getting it more severely, are going to be our diabetics, persons with heart disease, persons who may have had an episode of cancer or recovering from cancer, of sickle cell, arthritic, and generally persons who are aged. As persons get older, their immune system starts to wane, starts to diminish. A diabetic who has elevated blood sugar and blood sugar is out of control, their immune system is going to be confused. It's going to be a wreck. So all these persons are at a disadvantage. I want to say something. I hope it's not too technical. The virus, when it gets in, it's able to get into our body through our nose, our throat, and our lungs. There are receptors there, these special receptors like windows. The virus has a key for those windows. You understand? The problem is that once it gets in, there's some of those windows, our heart, our kidneys, and our blood vessels have a huge amount of these receptors too. So as the virus is floating around the blood, it can attack the heart, it can attack the kidneys, it can attack the blood vessels, it can even attack your small intestine, it can affect your brain. So that, that's why the wearing of masks and so has been so important. But when it gets into our body, if there's no vaccine that's created antibodies to stop it, the virus is going to float around in our bloodstream, and where it finds a target, it's going to attack our heart, our kidneys, our thing. And so these persons are going to rapidly deteriorate if they are left to reach that far. And as I said again, we don't have the kind of medication that Donald Trump got. So we have to vaccinate in order to stop the virus at the door, trying to climb through the window. That's where we have to stop the virus. And I'm hoping that persons can see this, because I hope we don't have any more deaths. And they say 2% of your cases often go towards death. We haven't reached 2%, but I am really glad that we now have a high level of wearing masks, a higher level, I should say, as is mandatory. And I'm hoping that people can also be vaccinated as the ultimate way of protecting them.
Thank you. Some of the questions. After the administration of the vaccine, would mask wearing still be a requirement? Someone that wants to know as well, how many times you have to take the vaccine and if it's safe? And a biggie, is AstraZeneca being made for third world countries? So that's 3 in one there. I don't know if you want to go first again, Doc.
Well, I thought Darlene would actually take that AstraZeneca. I like to tackle, by the way. I want you to tackle that first, please.
Okay, I'll take the AstraZeneca. And AstraZeneca is being used in the UK and many European countries. Actually, it was approved by the European Union and by the UK stringent agent. So I wouldn't consider those countries as third world countries, and they have been using it before. So the question there would be no. And then I believe the other question was, I missed the second question. What was it?
How many times you would have to take the vaccine?
Okay. Yeah, so that depends on the manufacturer, but this specific AstraZeneca is 2 doses, 1 doses, and the other one from 8 to 12 weeks afterwards. But it's 2 doses. And so far, the ones that have been approved, most of them are requiring 2 doses.
Yes, there's a Johnson & Johnson vaccine that requires 1 dose. Remember, we were talking about efficacy. Its efficacy is lower, but the convenience of 1 dose can be attractive. Let me say, I think there is, and I'm going to introduce this word again, vaccine nationalism. There is pressure on a lot of countries in the North, government, to make sure their country is supplied first. And some countries have actually purchased almost 5 times the amount of vaccine than they need for their population, And I wouldn't call any names and so forth, but that reduces the amount of vaccine that's available. Now, the Pfizer and the Moderna vaccines are the very expensive vaccines. Maybe in the region of about 30, to 40 US dollars a dose. And it's been interesting. AstraZeneca has made a commitment that it will sell its AstraZeneca at 3 US dollars a dose to poorer countries. And that's all. AstraZeneca has been going through a few challenges, I would say, in the sense that their profile in South Africa, and all the vaccines to be used in South Africa, because of the South African strain, they're probably not going to do as well as they should. They're doing a massive rollout. They probably must have hit about 10 million doses in England already. But there's been some infighting, I would say, between Germany and England, and everybody would have read about that. And it's created a lot of resentment. But the Caribbean, I would say, does have a fair amount of faith in the AstraZeneca because of the strain we have here now. It will be very effective for the strain we have here now. There's been also some criticism of AstraZeneca that in their study, they may not have had enough elderly persons. People wanted to see a higher percentage of that 10%. People would have wanted to see 15, 20% of the persons being like. But I found that is very good. That's very decent. But some people say they would like to have seen higher. So, but you can't claim that it is not going to work against the elderly. Now, we must talk about these things, because if we don't talk about, someone else is going to raise them and say we didn't raise them. But I believe that the AstraZeneca is a good vaccine, and it's going to be very useful for us. It's going to be one of those that is going to be coming down, I think, to other islands of the Caribbean as well. It's just that we are also going to be looking at some other vaccines, such as the Sputnik and others, so as to provide to our people a savings in the end.
So as we get ready to wind down this evening's program, Doc, someone wants you to tell them how you felt physically after you took the Sputnik vaccine.
Let me tell you, I felt damn good. I felt really good. Let me tell you the truth. But I felt good, not because the vaccine gave me any boost or anything like that. I felt good because I felt relieved. I was a little worried that as a spokesperson, what if I came down with COVID? You know what I mean? I think persons would somewhat laugh and so forth that, those things were in the back of my mind, never troubling me. But I tell you something, I felt really good after the vaccine. I didn't feel a thing. And I am recommending the vaccine to other persons. It's not going to put an extra bounce in your step. But I look forward to the day, maybe 6 months from now. I'm going to be criticized for this. If we reach 70% vaccination, I see carnival and those kind of things. I see independence. I see, us being able to, I see myself being able to hug somebody again. You know what I mean? As opposed to all the distancing. So no doubt we have to keep on with our mask and so forth and washing hands and things like that. But I look forward to the day. I'm seeing the light at the end of the tunnel, and I want everybody to join me. If we get 70% and go to 80 and 90%, Carnival is coming again, you know?
Okay, and I was thinking that's the last question, but I'm seeing really some good things that we should respond to. Are you of the opinion that the vaccine will be like the flu shot going forward, where it will be required to be taken annually? And if there is a limit in the availability of vaccines to give the second dose, would you recommend a single dose or follow the 2-dose protocol until more vaccines are available? And someone wanted you to talk about the difference between AstraZeneca and the one that you took, the Sputnik, etc. And how far along is the Cuban vaccine? Does anyone know?
Darling, I've been studying it. I'm not really too sure. I think that we got to explore all the possibilities, even though we are part of COVAX and so forth, because we don't know what is going to be released from the North and whether those countries are going to hold on to some of them and there's not going to be sufficient supply. But I also think that if there's 2 doses required, 1 dose will not be enough. The efficacy of 1 dose may be 20%, 30%, that sort of thing. So you need the second dose to get it up to that 90, 92%. I personally, on review of the AstraZeneca and the Sputnik, I think the Sputnik has a slightly added edge because it uses a kind of a double method. They use what's called an adenovirus mold to really get the vaccine going. And the Sputnik uses 2 of them, whereas the AstraZeneca uses 1. But guess what? They're both collaborating. They're sharing notes. They're talking to each other. And Oxford University, and imagine Oxford University and Russia talking to each other about vaccines and sharing notes and comparing data and so forth. This is all good. And this is one of the things that Darlene, we talk about. The collaboration that's been taking place around the world has been unprecedented. And I'm really pleased about that. But I think that the Sputnik has a slightly added edge. And just because it's Russian, I don't have that level of prejudice and discrimination and so forth in that regard. But the AstraZeneca is also good. In fact, I would say it's also damn good.
I just wanted to add there, and I know because to ratify that we should take the 2 doses. We've heard about countries that took the strategy of giving the 1 dose and giving the manufacturer time to develop the second dose. So as opposed to if I have 1,000, I give 1,000 people the first dose and wait the 8 weeks, expecting the others to give the second dose. That's a strategy, an emergency strategy. But what should not happen is that you take 1 dose and think you have enough defense. You should ensure you get your second dose.
Okay. Any word on the Cuban vaccine? How far along is it?
The Cuban vaccine, the Indian vaccine, I know that Barbados has been also having some discussion with India. Our Prime Minister has made contact in terms of both cases. We're doing our review. I think that any vaccine that is proposed needs that scientific review. And so CAF has come up with a policy that we don't absolutely need World Health Organization authorization. That's important for COVAX. And I think that, as you know, everything is going through for the vaccines they have. But what we do need is to know that in one major jurisdiction, so like in the United States, you have Scientific Council, the FDA, and CDC approving vaccine. If they've approved vaccine, then we could use those. In England, similarly, since England has utilized AstraZeneca and approved AstraZeneca, we can use AstraZeneca. And we can wait until the World Health Organization comes along and does the approval, but we are also dependent on certain nation approval as to adopt our approval. Every single vaccine, we also do our complete review to make sure, and we will do so for the Cuban and the Indian before anything comes here. we will do those and have a discussion with the people of St. Vincent and the Grenadines.
And finally, before you both go, what would you say to those who are hesitant and adopting a wait-and-see attitude before making a decision on whether or not they should vaccinate?
Darlene?
The decision of being vaccinated is a personal decision. And I don't think any country has the COVID-19 vaccine as mandatory. But as Dr. JERROL been saying the whole night, and I've been ratifying, I would encourage you to get your vaccine. The vaccine is safe, and independent of the level of efficiency, whatever protection we can get from the vaccine, we need it now. Unfortunately, we cannot wait. We cannot wait till the perfect vaccine come out. That is not going to happen. And once the issue of safety is solved, which we already solved, I think we should go for it. And I haven't taken mine as yet because it's not available here as yet, but I would be the first in the line when it comes here.
Yeah, Teresa, if I could say, once again, hands, space, face, and vaccinate. But I also want to tell persons, it is not true that the vaccines we're looking at causes sterility of our women. That's an old thing that they tried in Nigeria and those places. It caused a massive outbreak of polio. It's not true there's any chip, a liquid chip in the vaccine. It's not true about 5G. It's also not true that the products inside there are gonna cause cancer and so forth. There's so much stuff out there, it's gotten people very confused, and some people believe it. I know it's hard to trust doctors and nurses and so forth, but we need to vaccinate initially at least 70%. And we want people, those who believe, to come forward. We are going to try our utmost best to convince you who don't believe, who have doubts, who have hesitancy, to join us. And I took it, Prime Minister took it, Dr. Roger Duncan took it, the CMO, Simone Keyser took it, and we're all okay, you know what I mean? And I haven't grown any horns, I haven't grown a tail, I am fine, you know what I mean? And I feel good, and you can protect yourself to hands, face, space, and vaccinate, Teresa. You know, I'm looking forward to it.
Thank you so very much as usual, Dr. JERROL Thompson. Also special thanks to our guest, Family Health Advisor for PAHO and WHO in Barbados and the Eastern Caribbean Islands. Thank you for coming onto our program. I'm very sure, Dr. OMEIR, that we will be seeking you out again. We have Dr. T, who we always call on anytime. Thank you so much. Your insights were very useful and helpful, I'm sure. See you again next time. We'll be back next week for another edition of Roundtable Talk. Good evening.
Bye.
Good morning, everybody. Welcome to our staff meeting. We'll now have the minutes of the last meeting.
Miss Peters, you don't know it's bad manners to cough and don't cover your mouth?
Well, listen, I have a common cold, and at some point, it is expected that I'm either going to cough or sneeze. So you all don't have to be that dramatic.
But we don't know if it's cold or COVID. Some people like be wrong and strong. Imagine you cough and don't cover your mouth, and because people talk is a problem.
Well, no wonder COVID spreading like wildfire across the world.
None of you can give me all the virus in here, you know.
Is that I practice good hygiene or I stay at home? I ain't able.
Well, seeing that you know so much about proper hygiene, enlighten me now.
What you mean? It's common knowledge. If you have to cough or sneeze, you cover your mouth with a tissue or the cuff of your elbow so that the virus won't spread in the atmosphere. That's it. It's not rocket science.
Okay, miss, know it all. Now I know better, I will do better.
Remember, it's not about who knows it all. Our health is a shared responsibility. For our next staff development session, I'm going to ask a medical doctor to discuss respiratory hygiene with us. So let's get back to our meeting.
Diabetes is among the top 3 leading causes of death. Are you living with diabetes? If so, you may be at risk for developing complications, especially during this COVID pandemic. Let's tackle this problem by complying with taking your medication, increasing your physical activities, increasing eating a balanced and nutritious diet, checking your feet as foot care is important, and contacting your healthcare provider. Remember, diabetes can lead to blindness, amputation, and numerous harmful and life-threatening effects. Protect yourself. Know your numbers. Hearts Movement SVG reminds you to love your body and treat it right. Your health, a shared responsibility.
Read, learn, grow. The children are the future. Help them read, learn, grow. Only reading is the key, so help them read, learn, grow. Let's show them how much fun it is to read, learn, grow. So parents, you play a part. First and foremost, reading from so young is advantageous. Link with the teachers. Working hand in hand is a must. Just 10 minutes of your child reading to you is a plus. Get fun books, make reading priority. When children read, they are able to learn. And the more they learn, the more they grow. So parents help the kids read, learn, grow. Reading is fun, kids have to know. Read, learn, grow. The children are the future. Help them read, learn, grow. So parents, you play a part.
This message is brought to you by the OECS USAID Early Learners Program, funded by United States Agency for International Development. For more information, log on to www.oecs.org/ELP.
As we applaud the efforts of the Ministry of Health, Wellness and the Environment in managing the spread of COVID-19, we wish to remind you to follow all the protocols. Most importantly, practice proper hand washing, cover your cough and sneeze in the crook of your elbow, do not touch your face, wear a mask when in public or where it is not possible to practice social distancing. Call the COVID-19 hotline at 534-4325 if you are experiencing flu-like symptoms. Together, we can stop the spread of COVID-19. A message by the National Reconciliation Advisory Committee.
Stop the spread of viral infections, including the flu and COVID-19, by practicing proper hand washing. Follow these simple steps. Remove all jewelry before washing hands. Wet hands using running water. Place liquid soap in hand. Circulate using rotational movements, interlace fingers, and repeat switching hands. Wash back of fingers, rotating them in the palms. Wash fingertips, rotating them in palms. Wash thumbs using rotational movements. Thoroughly wash hands down to the wrists. Rinse hands. Dry with clean tissue. Turn off tap using tissue. Use tissue to open door and discard in bin. A simple act can make a huge difference. Stop the spread of viral infections, including the flu and COVID-19, by practicing proper hand washing. This is a message from the Ministry of Health, Wellness and the Environment.